Hi, I'm Dr. Shelina Manji. I'm a pediatrician and the medical director here at Five Counties Children's Center. My start in pediatrics happened quite some time ago. I began my career as a speech-language pathologist working in a children's treatment center similar to this one. I worked in several, in fact, throughout Ontario. And because I was so taken with the work that I did, I decided that I wanted to take it further, and that's why I went to medical school. I went to medical school at McMaster and then followed that with a residency in pediatrics and a subspecialty training in genetics. I had actually been working in the States when I was approached for this position, and of course I jumped at it because for me it was going the full circle. It was the opportunity to bring back the expertise that I had now developed. It was an opportunity to revisit the work that I had previously done as a speech pathologist, but to have a more global view because now I had medicine in my pocket as well as genetics. So families can access us in two ways really. If you're looking for a consult with me personally, then you do need a referral from either your family physician or a pediatrician, and to share with them what some of your concerns were so that they can make the appropriate referral to me here at Five Counties. If you're calling or if you have a concern about your child's development, you feel that your child is not speaking as much as they should be, or your child is falling more often than they should, or you have some other concerns about your child, just call us here at Five Counties. You will be connected to our wonderful intake department, and Glenna in intake will spend some time talking to you, trying to understand better the fullest extent of your concerns so that she can more appropriately make the referral to the correct people here at Five Counties. The first appointment with me as I meet new families is really all about me getting to know the family as well as the child. It can either happen just by myself alone, and my focus really is to ask a lot of questions and get as much input from the family as I can about what their concerns are and what it is they are seeking help with. I also go into the history of the child. I will also often look at the family history, what the parents are also some of their challenges, challenges of the siblings, and also what's happening at the school. Sometimes families will leave with some information, but I'll be gathering additional information from the school. So I may send out forms to the school with parents' permission so that I can gather more information from around the community about this child. Occasionally our assessments are done in a team context where the speech-language pathologist, physical therapist, occupational therapist, our resource teacher, even our social worker may join us. And then together as a team, we will do our assessments, and I'm there to gather some of that information. That usually ends with me then doing a physical exam on the child. My physical exam actually begins even sooner than that because as I watch the child playing with the various toys that we have in the room, I gather a lot of information about their interaction, how easily they're able to move around the room, the kinds of toys that they select to play with, the nature of their play, the kind of chatting that they do as they're playing. And then I usually conclude all of that with a routine physical exam, meaning a height and a weight, listening to heart and lungs, and checking for any other things that I think might be appropriate for this child's diagnosis. So here at Five Counties, we are fortunate to have such a great complement of experts. That means that we're able to make a variety of different diagnoses very effectively. We offer specific diagnosis for autism, and we use the ADOS test to do that. For those of you who are not aware of what that is, ADOS basically stands for Autism Diagnostic Observation Scale, and essentially it's a collection of books, puzzles, games, questions that we administer or that we ask of the child. Typically we schedule a long appointment. It's a 2-hour appointment, and it's usually handled with two people, myself and my colleague, with one of us actually interacting with the child and the other one taking exhaustive notes on whatever the child is saying. We then have the parents wait for a few minutes, we score up the data, and on that very day we're able to share with the parents what the outcome is. The ADOS comes in several different modules so that we're able to target it to the child's language level, the child's age, so that it ends up being a little exercise that's a lot of fun for the children, and it's also very meaningful for the families. Families are able to be a part of it, or they're able to observe from a one-way mirror so that they know exactly how the children reacted and responded to us. The other test that we offer now is for fetal alcohol syndrome. Fetal alcohol has been a bit of a challenge, I think, for most of us clinicians for quite some time, but we are fortunate now that I have been able to get some additional training, and we've been able to secure some additional technology whereby we're using assistive devices as well as facial recognition software that helps us towards making the diagnosis of fetal alcohol syndrome. So no longer is it the case that somebody is subjectively making a judgment on a child, but it is very objective, it is very measured, and therefore we can feel secure in what we're saying to families as we lead them to the next stage in the path for that child. I'm delighted to be here at 5 Counties, to be able to help children with special needs, to help families, to help make diagnoses, and to make plans for their future growth and development.